The military vehicles arrived at 6:42 in the morning, 4 of them. Black, armored, moving fast through the hospital parking lot like they owned everything they touched. Then the soldiers came out. Full tactical gear, rifles up, faces unreadable, and they didn't stop at the front desk. They didn't wait for security. They walked straight through the sliding glass doors of Blackstone Regional Hospital, and one of them, the one with the rank insignia and the kind of eyes that had seen things that don't leave you, looked at the charge nurse behind the desk and said, "Where is Lieutenant Emily Carter?" And everyone laughed. Because Emily Carter was currently pushing a mop bucket down the hallway of the 3rd floor. If this story already has you hooked, follow my channel, hit like, and drop your city in the comments. I want to see how far this story travels. Now let's go back to where it all started. It had started 6 weeks before the soldiers came, on a Tuesday that felt like every other Tuesday, which is to say, it felt like nothing until it didn't. Emily Carter showed up to her shift at Blackstone Regional the way she always did, 10 minutes early, coffee she hadn't touched yet, hair pulled back tight enough that it gave her a headache by noon. She was 29. She had a face that people forgot in hallways and remembered in emergencies, the kind of face that didn't announce itself. She wore her scrubs the same way she'd once worn her uniform, like they were functional, not decorative. The ER at Blackstone was a mid-sized operation in Harlow City, the kind of hospital that wasn't quite big enough to be impressive and wasn't quite small enough to be forgiven for its failures. It had a decent trauma bay, 2 attending surgeons on rotation, and a chief physician named Dr. Marcus Holt, who had the professional confidence of a man who had never once been told he was wrong and had mistaken that silence for proof. Emily had been at Blackstone for 8 months. In those 8 months, she had started 3 IVs in under 20 seconds on patients with collapsed veins. She had talked a septic patient through a procedure when the attending froze, and she had twice identified medication errors before they reached the patient. She had not made a single formal complaint, not filed a single grievance. She had done her job. That was, apparently, the problem. "Carter." Dr. Holt didn't look up from his tablet when he said her name. He was standing at the nurse's station on a Tuesday morning, and he said her name the way you'd say speed bump, an obstacle, minor, slightly irritating. "The Reyes patient in Bay 4. I ordered a medication adjustment last night. Why hasn't it been updated in the chart?" Emily set down her coffee. "Because the adjustment you ordered was contraindicated with his current anticoagulant. I flagged it with Dr. Osei before the end of shift. She agreed and put a hold on it pending review." Holt looked up then. He had a particular look. She'd cataloged it by now. That he used when a subordinate said something technically correct in a way he found personally offensive. It was a slow blink, followed by a slight tightening around the jaw, followed by a smile that wasn't a smile. "You flagged it," he said. "Yes." "With Dr. Osei?" "Yes." "Without consulting me first." Emily kept her face neutral. The concern was time-sensitive. Dr. Osei was available. The protocol for medication conflicts. I know what the protocol is. He put the tablet down. "What you don't seem to understand, Carter, is that in this department, when you have a concern about my orders, you bring it to me. Not to Osei. Not to anyone else. To me. That's not a suggestion. With respect, Dr. Holt, the patient's safety is my responsibility." His voice went flat. "Not yours. You are a nurse. You administer care. You document. You communicate through proper channels. You do not second-guess attending physicians. Am I being unclear?" The nurse's station had gone quiet in that specific way. Rooms go quiet when everyone is pretending very hard not to be listening. Emily looked at him for a moment. She thought about 8 things she could have said. She chose, "Understood." She picked up her coffee and walked back toward Bay 4 to check on Mr. Reyes, who was, in fact, doing better because the medication adjustment hadn't gone through. That should have been the end of it. It wasn't. Over the next 3 weeks, things began to happen in the small, deniable way that institutional hostility always works. Nothing dramatic, nothing you could point to directly, just a slow accumulation of friction that ground against you until you either left or became someone you didn't recognize. Her shift assignment started changing. She'd been on trauma rotation, the work she was good at, the work she'd specifically been hired for. Quietly, without explanation, she got moved to administrative floors, then to intake processing. Then, on a Wednesday in her 6th week, her supervisor, a woman named Denise Marlowe, who had the demeanor of someone who had learned long ago that the path of least resistance was the only path, handed her a new assignment sheet without making eye contact. Facilities support, 3rd floor. Effective immediately. "This has to be a mistake," Emily said. Denise was already turning away. "Dr. Holt requested a review of all nursing assignments. Yours was flagged for performance concerns." "What performance concerns?" "I don't have the specifics." "Denise," Emily kept her voice level, "I need to see the documentation. Whatever was filed, I have a right to review it. You'll be able to access it through HR. In the meantime, the assignment stands." A pause. "I'm sorry, Emily. I really am." The apology landed somewhere between genuine and useless. Emily spent her lunch break in the HR office, where a man named Gerald, who was deeply committed to his lunch also on his desk, told her without looking up that the performance review cited 3 incidents of insubordination, 2 complaints from attending physicians, and 1 notation about unprofessional conduct during a patient interaction. None of it had happened. Or rather, none of it had happened the way it was written. The medication flagging had become undermining physician authority. A question she'd asked in a team debrief about discharge timing had become inappropriate conduct. There was a 3rd incident she couldn't even place, described in language vague enough to be unfalsifiable. "I'd like to file a formal response," she said. Gerald handed her a form without looking up. "Processing takes 4 to 6 weeks." She took the form. She filled it out that night at her kitchen table, methodically, with the same focus she'd once used to write after-action reports in conditions that made a kitchen table seem absurdly peaceful. She filed it. She showed up to her facilities support assignment the next morning, and she pushed the mop bucket down the 3rd floor hallway, and she did not let a single thing show on her face. 3 more weeks passed. The formal response went nowhere. Dr. Holt submitted an addendum to her file citing continued attitude issues. 2 other nurses started avoiding her at lunch, not out of cruelty, she thought, but out of that particular self-protective social instinct people develop when they watch someone become a target. You don't want to be adjacent to the person the institution has decided is the problem. On a Friday afternoon, she was mopping the corridor outside the administrative wing when she heard Holt's voice through a half-open office door. "Just a matter of time before she resigns. Women like that always do. Too much pride to stick around when they realize they've already lost." She didn't stop walking. She didn't adjust her pace. She kept her eyes on the floor in front of her, and she thought about a night in a forward operating base 4 years ago, when she'd had her hands inside a man's chest cavity in the dark because the generator had failed and the headlamp she was using had cracked against the truck door, and she'd kept going anyway because you didn't stop in the middle. You didn't stop. She wrung out the mop and moved to the next section of hallway. What nobody at Blackstone Regional knew about Emily Carter, because she hadn't told them and it wasn't on the resume she'd submitted, was that the 8 months she'd spent as a nurse there represented roughly 8 months out of a total service record that spanned 6 years, 2 combat deployments, and a classified casualty response operation that had put her in places she still couldn't name in public. She had enlisted at 21, initially as a medic, and within 2 years had been selected for advanced trauma specialist training through a military medical program that took maybe 30 candidates a year and graduated fewer than half. She'd learned to triage mass casualty events in conditions that bore no resemblance to a hospital. No clean floors, no reliable equipment, no backup that wasn't also getting shot at. She'd learned to make decisions in seconds that physicians with 20 years of training would hesitate over for an hour. She'd left the service at 27. Not because she'd been asked to leave, and not because she was finished, but because something had happened on her last deployment that she hadn't fully processed, and she needed to be somewhere that wasn't a military base while she figured out what she wanted her life to be now. She'd applied to Blackstone because it was in Harlow City, which was far enough from where she'd grown up and far enough from every base she'd ever been stationed at that it felt like neutral ground. She'd listed her nursing credentials and her civilian medical certifications and left the rest off the form because it wasn't relevant. She just wanted to do the work. Quiet. Useful. No one knowing her history. That particular plan had worked out fine, right up until it didn't. The morning the military vehicles arrived was a Saturday. Emily was on her third hour of the facility's shift, had already done the second-floor bathrooms and the administrative hallway, and was working her way toward the East Wing stairwell when the first sound reached her. Not an alarm exactly, more like the building's ambient noise changing. A shift in pressure. Feet moving faster than they should be. Voices in the lobby going from the normal hospital murmur to something higher and less controlled. She put the mop against the wall. By the time she reached the top of the stairwell landing, she could see down through the window to the parking lot, and what she saw made something in her chest go very still and very focused in a way that had nothing to do with fear. The vehicles were military. The configuration, 4 units, tactical spacing, the way they'd positioned themselves relative to the exits, that wasn't a courtesy visit. That was a response to something. She was already moving toward the stairs when her radio crackled. Not her hospital radio. The small one she kept in her locker because old habits don't die, they just wait. Emergency band. She didn't catch all of it, but she caught enough. Convoy, multiple casualties, en route, ETA 7 minutes. She did the math without meaning to. 7 minutes. Multiple casualties from a convoy. That meant blast injuries, fragmentation, probably burns. The ER at Blackstone had a trauma bay that could handle 2 critical patients simultaneously if everything went perfectly, and nothing in a mass casualty event went perfectly. She was halfway down the stairs when she heard the lobby. Asking for a nurse? What nurse? He said Lieutenant Carter. Does that mean anything to anyone? Laughter. Actual laughter. The kind that comes from a group of people who think they're all sharing the same joke, which is the most dangerous kind because it makes everyone feel safe in being wrong together. Emily pushed through the stairwell door. The lobby had a particular energy. She'd seen it before. That bristling collective tension of a hospital about to be overwhelmed and not quite knowing it yet. The soldiers standing at the entrance were not laughing. They were scanning the room with the controlled, methodical attention of people who had learned that the most dangerous moments were the ones that looked calm. The one in front was tall, built with the kind of density that comes from actual use rather than gym hours, with the rank of a special operations commander and a face that suggested he had not slept in at least 36 hours and had no particular feelings about that. He was talking to the charge nurse, whose name was Patricia, and Patricia was doing her best, which under the circumstances meant she was smiling with visible strain and saying, "I'm sorry, we don't have anyone here by that title." "Lieutenant Emily Carter," the man said again. His voice didn't rise. It didn't need to. "Former 91W, advanced trauma specialist. I have information she transferred to civilian nursing in Harlow City. This hospital." "We have an Emily Carter," Patricia said slowly. "But she's not, she's in facilities support. She's not, where is she?" It wasn't a question. Emily said, from the edge of the lobby where she'd stopped, "Here." Every head turned. She was still holding the mop handle. She'd brought it without thinking. Old muscle memory. You don't put down what you're carrying until you know what you're walking into. She looked at the commander and he looked at her, and something passed between them that the rest of the room couldn't read. The shorthand of people who have operated in the same context. He straightened. Just slightly. "Lieutenant?" "Commander." She set the mop against the wall. "How many?" 6 confirmed. 2 critical, 2 serious, 2 walking wounded. Blast event, IED variant, approximately 40 minutes ago. We had a field medic on site, but we lost him in the secondary. What's their current status? 2 are tanked. We kept them stable in transport, but he didn't finish the sentence. He didn't need to. Okay. She was already scanning the lobby, running the geometry of what she knew about the ER layout, the available bays, the equipment she'd seen on the trauma floor during her first 2 months. "I need to get to the ER, now." Behind her, she heard Dr. Holt's voice. He'd come down from somewhere, drawn by the noise, and his voice had the particular quality of a man who had just walked into a situation he didn't understand and was about to try to take control of it. "What is going on here? Who authorized military personnel to enter this facility? Someone needs to—" "Dr. Holt," Emily said, without turning around. Carter, you need to go back to, I need you to get out of the way. She said it quietly, the same tone she'd used in the field when clarity mattered more than diplomacy. There are 6 military casualties incoming, 2 of them critical. I need access to the trauma bay, I need the full crash cart, and I need whoever's on surgical today to be scrubbed and ready in 10 minutes. Holt stared at her. You're a janitor. The commander, his name was Voss, she'd remember later, Colonel Damon Voss, looked at Holt with an expression that was not hostile exactly, just comprehensively unimpressed, and said, She is Lieutenant Emily Carter, decorated combat trauma specialist, former lead medic of the 3rd Special Operations Casualty Response Unit, 2 combat tours, 47 documented field saves. She is the person I am here for. He paused. Sir? The 6 soldiers standing behind him, who had been motionless, came to attention simultaneously. It was a small thing, a reflex. But in the lobby of Blackstone Regional Hospital, with the charge nurses watching and the orderlies watching and Dr. Marcus Holt watching, 6 armed special operations soldiers snapping to attention for a woman with a mop handle was not a small thing at all. Emily didn't look at Holt's face. She'd see it later in her memory, and she'd understand what was on it. The specific collapse of a man who has built his entire self-image on being the most important person in any room. But right now, she didn't have time for it. The radio on Voss's vest crackled. 3 minutes out. Move, Emily said to the room in general, and walked toward the ER. The trauma bay at Blackstone had 3 active bays and a 4th that they used for overflow. Emily had worked in it for exactly 6 weeks before she'd been reassigned, which was enough time to know where everything was and where the gaps were. The gaps were real. The supply cart for Bay 3 was missing the chest decompression kit. She'd noticed it her 3rd day and filed a note that had apparently gone nowhere. The crash cart had a defibrillator that sometimes needed a second to cycle. The suction unit in Bay 2 was reliable but slow. She filed all of this away in the 3 minutes she had before the first ambulance pulled up. Dr. Petra Ose, the one who had agreed with her about the anticoagulant 3 weeks ago, appeared at her elbow. Ose was 35, a solid general surgeon, not exceptional in a trauma context, but steady. That mattered. Tell me what you need, Ose said. Emily looked at her. You trust me? I flagged the same thing you did on Reyes, yes. Tell me what you need. Bay 1 for the 2 critical. I'll be primary on both. You're on standby for surgical consult, I'll call it. Bay 2 for the serious cases. Who's your best nurse? That's probably you. Who's second? Huang. Daniel Huang. Get him. Bay 3 for the walking wounded. Anyone with basic trauma training can manage. She was pulling on gloves as she talked, not looking at her hands. The chest decompression kit in Bay 3 is missing. Get it from supply or pull one from the OR. And tell whoever's running the defibrillator in Bay 1 that it needs 15 seconds to... I'll handle it, Ose said, and moved. The first gurney came through the doors at a run. Emily had a fraction of a second to take in the patient. Male, mid-30s, 2 medics holding pressure on what she could see was a lateral chest wound. Skin color wrong, breathing pattern wrong. And then she stopped thinking in words and started working. Get me that line now, both sides. I need a pressure reading. 80/50, dropping. He's got a tension pneumo. She didn't announce it, she just moved. Needle, 14th gauge, 2nd intercostal. You need to wait for the attending to... A voice she didn't recognize, one of the ER nurses who didn't know her, reflexive hospital protocol kicking in at exactly the wrong moment. Hand me the needle, Emily said, or step back. The needle appeared. She placed it. The release of pressure was immediate and audible, and the patient's oxygen saturation, which had been spiking on the monitor in the wrong direction, began to stabilize. Somewhere behind her, Dr. Holt said something. She didn't hear what. She was already moving to the second critical patient, who had fragmentation injuries across his left arm and chest, and the field dressing the transport medics had applied was holding but barely, and she could see from the way his eyes were tracking that he was starting to check out. Hey. She put her hand on his face, not gentle, firm, grounding. Stay with me. What's your name? His lips moved. Kowalski. Kowalski, I've got you. Eyes on me. It's bad. I've seen worse. She had. You're going to be okay, but I need you to keep your eyes on me and keep talking. Can you do that? Yeah. A breath. Yeah. Good. She was already working while she talked, hands moving through the assessment with a speed that came from repetition in conditions that made this ER look like a practice simulation. Tell me something. Anything. Where are you from? Ohio, he managed. Columbus. Columbus. Okay, I want you to tell me about Columbus. She worked. He talked. His vitals steadied. Not out of danger, not even close, but no longer in free fall. Across the bay, Osei was managing the serious cases. Huang had materialized from somewhere and was in Bay 2 with a competence that she noted and filed away. The walking wounded were in Bay 3 with 2 nurses who looked frightened but functional. The trauma bay had the specific controlled chaos of a situation that could go either way, and Emily had lived in that specific chaos for long enough to know that you didn't wait for it to resolve. You shaped it. Every decision was a direction. Every order was a vector. You kept moving until you had enough vectors pointed the same way that the chaos started to organize itself into something survivable. 40 minutes. That's how long it took before both critical patients were stabilized enough for surgical handoff, the serious cases were assessed and triaged, and the walking wounded had been cleaned and dressed and were sitting with water in plastic cups looking slightly dazed. Emily pulled off her gloves. Her hands were steady. They were always steady during. It was after that they sometimes weren't, and she'd learned to schedule that for later, somewhere private. She turned around. The trauma bay had an audience. That was the only word for it. Nurses she didn't know. Orderlies. 2 of the surgical residents who must have come down to watch. Colonel Voss standing at the perimeter with 3 of his soldiers, all of them with the same expression. The particular relief of military people watching someone do military medicine in a civilian context and do it right. And Dr. Marcus Holt. He was standing at the bay entrance. He had been there for some portion of the last 40 minutes. She didn't know how long. And he had the look of a man watching a building he thought he owned turn out to belong to someone else. Emily met his eyes for a moment. She didn't say anything. There wasn't anything to say that the last 40 minutes hadn't already said better. She turned to Voss. Who's next of kin for Kowalski? He's stable, but he'll want family notified before surgical. Already on it, Voss said. He paused. You still had it. I never didn't have it. He almost smiled. It was a military almost smile, which is to say a very slight adjustment around the eyes. No, I don't think you did. Behind Voss, one of his soldiers, a young one, 22 at most, with the shaken look of someone who had watched the last 2 hours from too close and needed a moment to process, said quietly, almost to himself, Who is she? Voss answered without looking away from Emily. The best trauma medic I ever served with. A pause. And apparently the last person in this hospital to know it. Across the bay, Dr. Holt had gone very still. And 2 of the hospital's administrative staff, who had followed Holt down from the offices above, were on their phones. Emily didn't know yet what they were calling about. She would find out soon. The 2 administrative staff members were still on their phones when Emily walked out of the trauma bay. She didn't look at them directly. You learned that early, in environments where looking at something directly told people you were paying attention to it, but she caught enough in her peripheral vision to read the body language. They weren't calling family members. They weren't coordinating with the surgical floor. The way one of them had angled himself away from the room, voice low, hand partially covering his mouth. That was a man reporting to someone above him, and not happily. She filed it and kept moving. There was a supply room at the end of the trauma hall where staff sometimes went to decompress between crises, which in practice meant it was a room where people stood against shelving units and breathed for 90 seconds and then went back out. Emily used it now. She ran cold water over her wrists at the utility sink. An old trick, something her first field supervisor had shown her, helps the heart rate come down faster than you'd expect, and stood there for a moment looking at the drain. 42 minutes in the bay. Both critical patients stable. No losses. She should have felt something clean about that. She mostly felt tired and alert and slightly off balance in the way she always felt when military context invaded civilian space without warning. Like two different versions of her life had briefly occupied the same room, and she hadn't been prepared for the overlap. The door opened. She didn't turn around. "You have about 15 minutes," Voss said, "before this gets complicated." "It's already complicated." "More complicated, then." He came to stand beside her, not close, the appropriate distance of two people who know each other professionally and haven't seen each other in 2 years. Holt went upstairs. "He's talking to the hospital's legal office." Emily turned off the water. "What's he telling them?" "Based on what my guys overheard, that you practice medicine without authorization, that you gave orders to physicians without credentials, that you created a liability situation." A pause. "He's going to try to bury what just happened under paperwork." She dried her hands. The paper towel was rough and slightly damp from the dispenser, the kind of small institutional failure that hospitals were full of. "He can try." "Emily," Voss's voice shifted just slightly. Not softer exactly, but more direct. "I came here because Kowalski and his team needed you. That's done now, or it's done enough. But I also came because I've been hearing things about what's been happening here, and I want to know if they're accurate." She looked at him. "What things?" "That you were reassigned to janitorial work. That there's a performance file on you that reads like it was written by someone who wanted you gone. That you filed a formal response 3 weeks ago and nothing happened." He met her eyes. "Is that accurate?" She thought about the form, the one she'd filled out at her kitchen table. Gerald and his lunch and his 4 to 6 week processing timeline. "Roughly." "Then I need you to know that we didn't just show up because of the convoy." He reached into the front pocket of his tactical vest and produced a folded document. Thick paper, official, the kind of weight that institutional correspondence uses when it wants to feel significant. He set it on the edge of the sink. "That came through our JAG office 4 days ago. Military Personnel Records Inquiry into a Civilian Employee. Triggered when your file got flagged during a routine credential check." Emily looked at the document, but didn't pick it up yet. "Flagged how?" "The performance complaints lodged against you referenced your military service. Specifically, they included language suggesting your background was a fabrication. Someone at this hospital told HR that you'd falsified your military credentials." He paused. "That's a federal matter. That's why JAG got involved. That's why when the convoy came in this morning and Kowalski's team needed a trauma specialist, and I looked at the map and saw you were 8 miles away, I came here instead of routing to Harlow General." The room was quiet enough that Emily could hear the ventilation system overhead, the low, mechanical breath of the building. "They said I fabricated my record," she said. "In writing." She picked up the document. She didn't read all of it. She knew how to scan these things. The structure was familiar, but she read enough. Her name, her service record, a formal allegation submitted through the hospital's HR department to a credentialing database stating that the military service history listed by Emily Carter could not be independently verified and was likely fraudulent. It was signed by Dr. Marcus Holt and the hospital's chief administrative officer, a man named Douglas Farrell, who she had met twice and who had both times given her the impression of a man who had learned to smile from a diagram. She set the document down. "How long have you had this?" she said. Not a question, quite. More like a fact being located. 4 days. I was already planning to come to Harlow City. The convoy moved my timeline." Voss watched her. "I know what that face means. It means I'm thinking. It means you're deciding how angry you're allowed to be." He said it without judgment. "You can be angrier than that." "I'm aware." She folded the document along its existing creases and put it in her scrub pocket. "I need to get back out there. Kowalski's surgical handoff is handled. Ose is managing it." Voss stepped slightly into her path, not blocking her, just slowing the momentum. "Emily, the JAG inquiry is already open. That doesn't go away. But the next few hours matter because Holt is going to move fast to get ahead of this, and if he files enough paperwork in the right order, he can make it messy. Let him file. I need you to not disappear into nurse mode and let this happen around you. I need you to be present for what's coming." She looked at him for a moment. Damon Voss was not a man who asked for things lightly, which meant when he asked, the ask was real. "All right," she said. "I'm present." They walked back out together. The next escalation came from a direction Emily hadn't fully anticipated, which was the staff. Not all of them. Not even most of them. But hospitals are social ecosystems, and social ecosystems have a particular immune response to disruption, and what had happened in the trauma bay that morning was a significant disruption. For 8 months, Emily Carter had been the quiet nurse who filed careful documentation and kept to herself, and then for the last 3 weeks had been the facility's support employee who people walked past without making eye contact. She had been, in the hospital's collective understanding, someone on her way out, and then 60 soldiers had shown up, and it turned out she was something else entirely. And that kind of revision requires a lot of people to quietly recalibrate their previous behavior, and nobody likes doing that, so some of them went the other direction instead. By 10 in the morning, there were 2 distinct versions of the morning circulating through Blackstone's break rooms and corridors. In one version, Emily Carter had heroically stepped up in a crisis and demonstrated extraordinary skill. In the other, she had overstepped, operated outside her authorized role, endangered patients through unsanctioned interventions, and the military's endorsement was either exaggerated or didn't change the legal reality of what she'd done. The second version was being actively circulated by people who had a reason to circulate it. Emily saw it happening. The small conversations that paused when she walked past, the looks exchanged between 2 surgical residents who'd been in Holt's orbit, and she tracked it the way she'd tracked field intelligence, noting the pattern without reacting to it. Daniel Huang found her at the nurse's station at 10:15. He was 26, had been at Blackstone for a year, and had the kind of face that showed everything he was thinking because he hadn't yet learned that professional environments sometimes required you to be less readable. "They're saying you could lose your nursing license," he said. No preamble, no softening. She appreciated it. On what basis? Practicing outside your scope, giving direct orders to physicians, unsanctioned. He stopped. "I don't think that's what actually happened. I was in Bay 2. I saw what actually happened. But that's what they're saying." "Who specifically?" "Holt's PA, 2 of the administrative assistants from the 4th floor." He hesitated. "And one of the nurses from intake. She wasn't even in the trauma bay. She talks to a lot of people." Emily thought about that. A 3-pronged circulation pattern, all of them connected to Holt or to Farrell's administrative network. It wasn't spontaneous. It was coordinated, or at least directed, in the loose way that institutional messaging gets directed. Nobody sends a memo saying, "Spread this story." They just make clear what version of events is safer to repeat. "Huang," she said, "what you saw in Bay 2, can you document it?" He blinked. "Document it how?" "Write it down. Exactly what you observed. Timestamp it. Send it to your personal email so there's a record that predates anything that comes through official channels." She paused. "Only if you want to. I'm not asking you to take a position. I'm asking if you're willing to be accurate." He was quiet for a moment. He was weighing something. She could see it. The specific calculation of a young medical professional deciding how much his integrity was worth in an environment that sometimes penalized it. "Yeah," he said. "Okay, yeah, I can do that." He left. Emily turned back to the nurse's station and found Patricia, the charge nurse who'd been at the desk when Voss arrived, standing 3 feet away, pretending to organize something she'd been pretending to organize for the last 4 minutes. "You can just ask," Emily said. Patricia put down the clipboard she'd been holding upside down. 6 years, she said. "Military." "Yes." "And you never, it was never on any—" "No." Patricia processed this. She was in her 50s, had been at Blackstone for 11 years, and had the specific worldview of someone who had watched a lot of institutional situations resolve in the worst possible way and had made her peace with it. "Holt is upstairs right now. Farrell, too. They've been up there for 40 minutes with the hospital's legal team." "I know." "Emily." She said the name carefully, like she was trying it out in a new context. "I should have, when they changed your assignment, I should have said something." "You weren't in a position to." "I was, though." I just didn't. She met Emily's eyes, and it was the most direct Patricia had ever looked at her. I'm in a position now, if that helps anything. It wasn't nothing. It helps, Emily said. The legal team came down at 11:30. There were two of them, a hospital counsel named Barrett, who had the energy of a man who billed by the hour and was currently billing very aggressively, and a younger associate who was carrying a folder that was already thick. They set up in a conference room on the second floor and sent a message through Denise Marlowe requesting Emily's presence. Emily went. She brought nothing because she didn't have anything yet, and she knew better than to walk into that room holding papers she hadn't reviewed. Barrett had an opening statement prepared. She could tell by the rhythm of it, the way he'd clearly organized his points in an order designed to establish a particular framework before she could respond. The framework was, Emily had operated outside her authorized clinical role, had given direct medical orders to credentialed physicians, had administered a clinical procedure, the needle decompression, without physician authorization, and had done so in a manner that created significant malpractice exposure for Blackstone Regional. The hospital's position was that while they recognized the circumstances had been unusual, the proper protocol had not been followed, and Emily's continued presence on staff in any capacity would require an immediate formal review. She waited until he was done. The needle decompression was performed on a patient with a tension pneumothorax, she said. His oxygen saturation was at 72 and dropping. He would have arrested within 3 minutes. There was no attending physician actively managing that patient at the moment I intervened. Every action I took falls within the emergency exception provisions of the Nurse Practice Act. She paused. Do you want the statutory citations, or do you want to move on? Barrett looked at his associate. The associate was writing something. The question of the emergency exception is something our team will need to review. It's not a question. It's established law. She kept her voice even. What else? Barrett adjusted. This was not, she gauged, how he had expected this conversation to go. The performance documentation in your file is fabricated, in part or in whole. I filed a formal response 3 weeks ago that your HR department has not processed. Additionally, she paused, calibrating, deciding that this was the right moment. Your chief of medicine and chief administrative officer submitted a formal allegation to a federal credentialing database 4 days ago claiming that my military service record was falsified. That is currently the subject of a JAG inquiry. I'd encourage your team to be very precise about what position the hospital wants to take in the next few hours, because the posture you establish now is the one you'll be defending in front of a federal investigator. The room was quiet. Barrett put down his pen. It was a small gesture, but it was a tell. A man recalculating. His associate had stopped writing entirely. You have documentation of the JAG inquiry, Barrett said. Not a challenge. More like a man locating the edges of a problem he'd just realized was larger than he'd been briefed on. I have a copy of the inquiry document, yes. She did not mention that it was in her scrub pocket. I also have the name of the JAG officer handling the case if your team wants to initiate contact. Another silence. Ms. Carter, Barrett said, with a different quality than he'd used at the start of this meeting, I think we may need to take a short recess. Take whatever time you need, she said. I'll be in the ER, in case anything else comes in. She stood up and walked out. In the hallway, she let out a breath that she had been holding very carefully for the last 20 minutes. Her hands were still steady. Good. She was almost to the stairwell door when her phone buzzed. Unknown number, but the area code was one she recognized. The military exchange prefix for the regional JAG office. She answered it. Lieutenant Carter? A woman's voice, brisk, focused. This is Captain Diane Mercer, JAG. I understand Colonel Voss briefed you this morning. Yes? Good. I need you to know that as of 2 hours ago, we've elevated the inquiry. We've requested the hospital's full personnel records related to your employment, including internal communications about your reassignment. A pause. We've also been in contact with the state medical board. They have an interest in what comes out of this. Emily leaned against the stairwell wall. How fast is this moving? Faster than Holt and Farrell think it is, Mercer said. That's all I can tell you right now, but I need you to stay in the building. I wasn't planning on leaving. And Carter? A brief pause. Don't let them push you out quietly. Whatever they offer you in the next few hours, severance, a mutual separation agreement, anything, don't sign it. Emily had been in enough situations to know that when a JAG officer told you not to sign anything, something was coming that would make a signature look very small in retrospect. Understood, she said. She hung up, stood still for a moment in the stairwell with the ventilation humming above her and the sounds of the hospital muffled through the door. Then her radio, the emergency band, the one she'd kept in her locker, crackled again. She almost didn't catch it. The signal was cutting in and out, the kind of intermittent reception you got in concrete stairwells, but she caught 3 words clearly enough to feel the ground shift under her. Second convoy, incoming. And then, half a second later, one more word, and a voice she didn't recognize but that had the specific flat urgency of a military medic reporting from a scene they were still actively working, pediatric. Emily was through the stairwell door and moving before the transmission finished. The word pediatric did something to a room that no other word quite did. It wasn't louder than other emergencies. It wasn't technically more complex in every case, but it changed the texture of the air in a way that Emily had noticed the first time she'd worked a pediatric trauma and had never stopped noticing since. A collective tightening, an involuntary response in every person present that bypassed professional training and hit something older and more animal. She came through the ER doors at a controlled run, which in practice looked like walking very fast with intent, and she found Voss already at the ambulance bay with 2 of his soldiers and a field radio that was crackling with broken transmissions. "Talk to me," she said. "School transport vehicle. Caught the edge of the same IED network. Secondary device. Different road. We didn't clear the full route in time." His jaw was tight. He was angry at himself. She could see it. The specific anger of a commander who had made a decision that turned out to be wrong. 8 children, ages 6 to 14. Military dependents being transported from base housing to a program in the city. The vehicle absorbed most of the blast, but the front section, he stopped. "It's bad." "How many critical?" "We don't know yet. The field medic on scene is a 23-year-old corpsman doing his best with what he has. Last transmission said 3 unresponsive, 2 with visible head trauma, rest ranging from walking wounded to moderate." Emily was already doing the math. 3 unresponsive pediatric patients in a hospital ER that had not been configured for a mass pediatric trauma event, with surgical capacity that was already partially committed to the morning's first wave. "Where's Osei?" "Still in surgical with Kowalski. Handoff took longer than expected. There was a complication on the table." Voss met her eyes. "She's not available." "Who's the pediatric attending on call?" "Dr. Reeves. He's been paged. He was at the clinic across town. He's 20 minutes out." 20 minutes. Emily ran that against the ETA she'd heard in the transmission fragment. They were going to arrive before Reeves, possibly well before. "Get me whoever is on the surgical floor right now," she said. "Residents, attendings, anyone with hands and a license. And I need the pediatric supply cart. It's on the 2nd floor, storage room B. It has a green handle. I need it in the trauma bay in 4 minutes." "I'll send someone," Voss said. "Send 2. She was already moving. The surgical resident she got was named Marcus Webb, 28 years old, 18 months out of medical school, and visibly terrified in a way he was doing an admirable job of trying not to show. He met her at the trauma bay entrance with the expression of someone who had just been handed a responsibility that was 2 sizes too large and was trying to figure out how to wear it. "I've done 2 pediatric trauma rotations," he said immediately, leading with his credentials, which told her he already knew they were going to be relevant. "I've never run primary on anything this—" "You're not running primary," Emily said. "I am. You're my surgical consult. When I need you, I'll tell you exactly what I need. Can you follow specific direction under pressure?" "A beat." "Yes." "I don't mean can you follow direction when it's calm. I mean when there are 3 kids crashing simultaneously and I'm asking you to do something you didn't expect. Can you do it without freezing?" Webb swallowed. "I'll do my best." It wasn't the confident answer. It was the honest one. She respected it more. Good enough? Stay close. She turned to the bay and started configuring it. Pediatric trauma had different geometry than adult. The equipment sizes, the drug doses calculated by weight rather than standard adult parameters, the IV access that was harder to establish on small veins. She pulled the pediatric supply cart alongside Bay 1, checked the laryngoscope blades, confirmed the endotracheal tube sizes, located the pediatric defibrillator pads, and set them within reach. Huang materialized at her left elbow. He'd clearly come back after their earlier conversation and stayed, which she noted without comment. He started setting up Bay 2 without being asked, mirroring her configuration with the efficiency of someone who was paying attention and could extrapolate. She checked the clock. 9 minutes since the transmission. When they come in, she told the room, Huang, Webb, 3 ER nurses who had assembled without being called, Patricia at the edge of the bay. I need clear verbal on each patient's condition as they arrive. Age and approximate weight if the medics have it. Mechanism of injury, anything administered in the field. I need that information fast and I need it accurate. If you don't know, say you don't know. Don't guess. Nods. The room had a different quality than it had had this morning. Not less frightened, but more organized around the fear, which was how you worked. Where's Holt? Huang said, quietly. Nobody answered. Which was, Emily thought, an answer. The ambulances came in at 11:58. The first thing she saw was a child who couldn't have been more than 8, a girl with dark braids and a field dressing on her left temple that had soaked through completely, being carried by a soldier who had clearly been holding her for the entire transport and was holding her now with the careful, rigid containment of someone who was terrified of hurting her more. The soldier's face was streaked with something Emily clocked as a mix of dust and dried blood, and the particular expression of a young man who had just had the worst hour of his career. She coded once in the vehicle, he said as he transferred her. We got her back. GCS was 6 when we loaded. Emily had her hands on the child before he finished the sentence. Pulse. Present. Weak. Irregular. Pupils. Right reactive, left sluggish. Breathing. Shallow. 11 per minute. She's hypoxic. Get me oxygen. 10 liters. Non-rebreather mask. She was already palpating the skull around the field dressing, feeling for the specific give of a depressed fracture beneath the blood. What's her name? Lily, the soldier said. His voice cracked on it. Her name is Lily. She's 8. Her dad is... He stopped. Her dad is Kowalski. The world didn't pause for that. It couldn't. But Emily registered it. The specific cruelty of a morning that had produced this particular symmetry, and then she put it in the same place she put everything that couldn't be processed in real time, and she kept working. Lily. She put her hand on the girl's face, the same way she'd done with the father 3 hours ago. Can you hear me? Squeeze my hand if you can hear me. Nothing for 2 seconds. Then the faintest pressure against her fingers. Good girl. I've got you. You're safe. She looked up. Webb, I need a head, CT ordered, and I need it prioritized. She's got signs of intracranial bleed. If I'm right, she's going to need surgical decompression, and I need Reeves here when I confirm it. I'll call, Webb said, and moved. The second critical came through while she was stabilizing Lily. A boy, maybe 11, with blast injury to his lower extremities and a tourniquet applied above the right knee that the field medic had placed correctly, and which had almost certainly saved his leg and possibly his life. He was conscious, which was both a relief and its own kind of complication, because conscious patients in significant pain were harder to work around. What's your name? Huang said, taking the second bay. Rafe, through his teeth. Don't take my leg. We're not taking your leg, Huang said. His voice was steadier than Emily expected from a man who'd looked scared 30 minutes ago. But I need you to hold still. Can you do that? The third critical was the one Emily had known was coming, the one she'd been bracing for since the word pediatric had come through the radio. A 6-year-old boy. Unresponsive. No pulse on arrival. She heard the medic say it, and she was already moving, hands on his chest before the gurney fully stopped. Full arrest? Duration? Estimated 4 minutes since the field medic lost pulse. We maintained CPR through transport. The medic was young, exhausted. His technique had been good from what she could see in the transfer. The compressions had been adequate, the airway maintained. He's 6. His name is Tommy. Emily started compressions. Pediatric rate, the heel of one hand, the right depth. You had to be precise because too hard on a 6-year-old's chest was its own damage. Epinephrine, she said. 0.1 milligrams per kilo IV push. Someone get me his weight. Medic says approximately 20 kilograms, Huang called from the next bay, simultaneously managing Rafe and tracking her situation. So 2 milligrams, now, and I need the AED pads on and charged. The next 90 seconds were the specific compression of time that cardiac arrest produced. Subjectively both very fast and granularly slow, every second a decision, the room reduced to the sound of her count in the monitor and the flat, unwavering tone that meant no pulse, and the quiet efficiency of people working at the edge of what they knew. Come on, she thought, not a command, more like a request made to nothing in particular. Come on. The AED charged. She paused compressions. Clear. The shock went through the small body. Nothing. She resumed. Charge again. Patricia was on the other side of the gurney, managing the airway with a bag mask, her face a controlled blank that Emily recognized as the professional face of someone who was not thinking about the fact that this was a 6-year-old boy named Tommy. Charge ready. Clear. Second shock. The monitor flickered. Then, not a clean sinus rhythm, not yet, but something. A disorganized electrical signal trying to find its shape. We have a rhythm, someone said. Weak, but VTAC, Emily said, reading the monitor. Don't celebrate yet. Keep the pads on. I need amiodarone, weight-based dose. Get me the pediatric formulary. Here. Webb had come back from his CT call and was holding the dosing reference out without being asked. She didn't have time to be surprised by that. She took it, confirmed the dose, called it out. The rhythm stabilized, slowly, like something being coaxed rather than commanded. Tommy's chest was rising on its own. Emily held her hand above his sternum for a moment, not touching, just feeling the ambient evidence of a breathing child. And then she moved to the next thing, because there was always a next thing. Dr. Reeves arrived at 12:24, 26 minutes after the ambulances, which was as fast as physically possible from across the city, and which was still 26 minutes after they'd needed him. He was 60, compact, with the specific energy of a pediatric specialist who had been doing this long enough that almost nothing visually surprised him anymore. He took 30 seconds to survey the bay. Lily on monitors with the CT results Webb had pulled up on the screen, Tommy breathing independently with a weak but real rhythm, Rafe stable in Bay 2 with Huang running his line. And then he looked at Emily. You ran all 3. Yes. Decompression on the girl? Not yet. I wanted you here first. The CT shows a subdural left hemisphere, approximately 8 millimeters. She's been stable for the last 12 minutes, but her GCS hasn't improved. Reeves was already looking at the scan. He had a way of reading imaging that was very fast and very still, like the information was coming in on a frequency only he could hear. You're right on the decompression. We need to move in the next... He checked the girl's pupils himself. 1, 2. Now. We need to move now. He looked up. Good call on holding surgical. Who's her attending? She doesn't have one here. She came in acute. Her father is upstairs post-surgical. Kowalski, the convoy from this morning. Reeves absorbed this without visible reaction, which Emily understood as the professional equivalent of a very controlled visible reaction. I'll scrub in. Get OR3. He started moving, then paused. The 6-year-old. The arrest. Tommy. Rhythm restored, currently in sinus with support. He needs PICU monitoring. Agreed. Another pause. He looked at her fully for the first time since he'd arrived. I've been at Blackstone for 9 years. I don't know you. No, she agreed. I'm going to need to know you after this. He left for the scrub room. Emily watched him go, then turned back to the bay, which was not finished. Was never finished, there were always more things. And she went back to work. It was past 2 in the afternoon when the bay finally reached something resembling equilibrium. Lily was in OR3 with Reeves and would be for at least another hour. Tommy was in the PICU with a rhythm that had steadied considerably and a night nurse who was monitoring him with the focused attention of someone who understood the stakes. Rafe was in recovery with his leg intact and a fractured tibial plateau that was bad but fixable, which by the standards of the morning was practically good news. The 5 less critical children had been managed by a combination of Huang, Patricia, and 2 nurses from upstairs who'd come down when the scope of the situation became clear. None of them were in danger. All of them were scared, and some of them were asking for their parents, and the hospital's family liaison was doing what she could. Emily was at the nurses' station, updating documentation with the focus of someone who knew that documentation was evidence, and evidence was going to matter, when she became aware of a presence at her shoulder that had a specific institutional weight to it. Douglas Farrell, Chief Administrative Officer, was 54 years old and looked like he had been designed by committee to look like a hospital administrator. Expensive shoes, a suit that was slightly too nice for a building where people bled, a face carefully arranged to project authority and concern simultaneously. He had not, as far as Emily knew, been in the ER at any point during the morning or afternoon. He was here now. "Ms. Carter," he said, "could we speak privately?" Emily finished the notation she was on, saved it, then looked up. "Here is fine." Farrell's eyes moved briefly to Patricia, to Huang, to the 2 nurses within earshot. He recalculated. "There are some matters regarding this morning that the hospital would like to—" "Mr. Farrell." Her voice was level. "I'm going to stop you there. I've been advised by JAG Council not to engage in any conversations with hospital administration that aren't documented and witnessed. If the hospital wants to communicate with me formally, it should go through the JAG office contact that your legal team already has." She paused. "Is there something else?" Farrell looked at her. He had a particular quality she'd noticed in institutional authority figures who were realizing they'd miscalculated. A kind of held stillness, like a man standing on ice that has just started to sound wrong beneath his feet. "The hospital deeply appreciates what you did today," he said, carefully. "I was doing my job," Emily said. "The job I was hired to do 8 months ago, before I was reassigned to mop floors." She didn't say it loudly. She didn't need to. "I'd recommend you go back upstairs, Mr. Farrell." He left. Patricia turned to the counter and started doing something with a supply list that didn't need doing. Huang was looking at his shoes. Neither of them was hiding their reactions very successfully, which was fine. Emily went back to the documentation. The thing about sustained high-stakes work was that the body accommodated it during and then presented the bill afterward. By 3 o'clock, Emily's hands had developed a faint tremor, not visible unless you were looking for it, but she could feel it, the delayed physiological cost of 6 hours of sustained adrenaline and precision work. She'd eaten half a granola bar from the break room at some point. She couldn't remember when. The headache that had started behind her right eye around noon was now fully established. She was in the family waiting room with a woman named Diane Kowalski, who had arrived 40 minutes ago from the base housing complex with the specific controlled terror of a woman who had been told her husband was in surgery and her daughter was also in surgery and had somehow kept herself together for the drive because she had 2 other children in the back seat who were watching her face to decide how afraid to be. Diane was 32, had her husband's same quality of compact steadiness, and was currently sitting with her hands in her lap and her eyes on the OR corridor, with the focus of someone running all available processing power on a single task. Waiting. Emily had come because no one else had, and because Diane had looked up when she'd walked past and said, very quietly, "Are you the one who helped them?" Both of them. Husband and daughter, 3 hours apart. Emily hadn't said that out loud. She'd sat down instead. "The surgeon doing Lily's procedure is Dr. Reeves," Emily said. "He's been doing pediatric neurosurgery for 23 years. She's in the right hands." "But you were the one. In the ER." Diane's eyes came to her. They were very direct, the eyes of a woman who needed actual information, not comfort-shaped like information. "What did she look like when she came in?" Emily thought about the tactical calculus of this question. The honest answer was bad. The softened answer would be obvious and would make Diane trust her less, which was the wrong outcome. She was unconscious and her vitals were unstable, Emily said. She coded once before arrival and was resuscitated in the field. When she got to me, she had signs of pressure building in her skull from the bleed. We stabilized her and got the imaging and called Dr. Reeves. Diane absorbed this. But she was alive when you got to her. Yes. And the boy, Tommy. I know his family. His mother is... She stopped. Is he... He's in the PICU, stable. He's breathing on his own. Emily paused. He's stable, Diane. Diane let out a breath that had clearly been held since before she'd walked in the door. Her hands in her lap tightened once and then released. My husband's going to want to know about Lily the second he's awake, she said. He's going to lose his mind. I know. The nursing staff on his floor is aware. They'll manage it. A silence. Not uncomfortable. The particular silence of two people who are both tired and both functioning on the other side of something significant. Thank you, Diane said. Not performatively, just as a fact. Emily nodded. She stayed another 10 minutes until the family liaison arrived to sit with Diane, and then she got up and walked back toward the ER. Voss found her in the corridor at 3:30 with the look of a man who had been managing multiple simultaneous situations and had just gotten to one that required a face-to-face conversation. We need to talk about what's happening upstairs, he said. I figured. They found an empty consultation room. Voss closed the door, which meant it was the kind of conversation that needed a closed door. Mercer called me 40 minutes ago, he said. The JAG inquiry has pulled internal communications from the hospital's server, emails between Holt and Farrell over the past 6 weeks. Emily waited. They knew, he said. Not about the deployment records. They were trying to find those, actually. They'd been attempting to access your full military file through unofficial channels for about 3 weeks. What they knew was that you were good, better than what they wanted in that position. Holt had an arrangement with a staffing firm. They were moving staff out and replacing them with contract workers that the firm had a financial stake in. You wouldn't play along. You flagged errors. You went to other physicians. You were, in his words, Voss paused. In his actual words from the email, a liability that won't be managed quietly. The room was very still. So the performance file, Emily said. Fabricated. Entirely. The complaints, the incident reports. There's email evidence that Holt coordinated them with 2 other physicians who have similar arrangements with the staffing firm. He looked at her. It goes past you, Emily. There are 3 other nurses in the past 18 months who got pushed out the same way. One of them lost her license before she could fight it. Emily put her hand flat on the table, not from anger, or not only from anger, but as a physical anchor, a way of keeping herself present in the room rather than in the calculation of what this meant, the scope of it, the specific and meticulous cruelty of a system designed to grind specific people down for money. The state medical board, she said. Mercer mentioned them. They're already moving. Holt doesn't know yet how much they have. Voss paused. And there's one more thing. She looked up. The allegation they filed to the credentialing database, the one saying your military record was fabricated. Mercer says that's federal interference with military records. That's not a civil matter. That's criminal. He let that land. Holt and Farrell are about to have a very different kind of problem than a license review. Emily was quiet for a moment. How long until they know what's coming? That's the thing. Voss's expression shifted, and she read something in it she hadn't expected. Not uncertainty, but a specific professional reluctance that meant what he was about to say was something he'd been holding back until now. Holt just called a press conference. She stared at him. What? 45 minutes from now, the hospital's PR office. He's going to make a statement about the unauthorized clinical interventions that occurred in the ER today. He's going to name you. Voss's voice was very controlled. He's getting ahead of the investigation by going public first. He thinks if he defines the narrative before we do, the board and the JAG inquiry will be playing catch-up. The temperature of the room seemed to drop by a degree. He's going to stand in front of cameras and say I endangered children, Emily said. Yes. She stood up. Where are you going? Voss said. To make sure I'm there when he does, she said. Voss looked at her for a long moment. Then he reached into his vest and pulled out his radio and said quietly, All units, conference room on 3. We move in 40 minutes. Emily was already at the door when her pager went off. The hospital pager, the one she technically shouldn't still have on her, the one no one had bothered to take back when they'd reassigned her to facilities. She looked at the number. Or 3. She answered it. Ms. Carter? Reeves's voice, clipped, efficient, with an undertone she'd learned to identify in operating surgeons. Not panic, but alert seriousness. The girl is out of surgery. She's in recovery. The procedure went well, but she's not waking up on schedule, and her ICP is climbing again. A pause. I need you. Emily stopped in the doorway. Reeves had been doing pediatric neurosurgery for 23 years, and he needed her. On my way, she said, and turned back into the hospital, moving away from the press conference and toward the recovery room, because Lily Kowalski was 8 years old, and her father was 2 floors above her, and her mother was in the waiting room, and the ICP was climbing, and nothing else in the building was as real as that right now. Behind her, in the direction of the administrative wing, she could hear, faintly, distantly, the sound of a room being set up for cameras. The recovery room at Blackstone was quieter than the trauma bay. Dimmer, cooler, the machines running at lower registers. The staff moving with the particular careful economy of people working around patients who were between states of consciousness. It had the feeling of a room that held its breath. Lily Kowalski was in the 3rd bay from the door. She was small in the way children were always smaller than you expected in hospital beds, the equipment around her disproportionate, the monitoring leads thick against her thin arms. Reeves was at her bedside when Emily came in, not doing anything yet, just watching the ICP monitor with the focused stillness of a man who had learned that sometimes watching was the most important thing you could do. Walk me through it, Emily said, coming to stand beside him. Procedure went cleanly. We evacuated the subdural, relieved the pressure. I was satisfied with the decompression. He didn't look away from the monitor. She should have started waking within 20 to 30 minutes of closing. It's been 41, and the ICP, which came down well intraoperatively, has been creeping back up for the last 12 minutes. He pointed at the waveform on the screen, a slightly irregular pattern, the peaks taller than they should be. Not crisis level yet, but the trend concerns me. Emily looked at Lily's face. Still, eyes closed, lashes against pale cheeks, the field dressing replaced now with proper surgical dressing, neater and smaller. A child who had been braiding something in the school vehicle 40 minutes before the blast, probably. She thought about that for a second and then put it somewhere else. What's her MAP? 82. And CPP? 70, which is fine, but if ICP keeps climbing and MAP drops at all, the window closes fast. She pulled on gloves and moved to the bedside, doing a rapid neurological assessment. Pupils first, right reactive at 3 millimeters, left still sluggish but not fixed. That was the same as before. She pressed the nail bed on Lily's right hand and got a faint withdrawal response. She moved to the left. Less response, but something. She's not herniating, Emily said. Not yet. No, but I want to know why she's not waking. Emily checked the medication record on the tablet at the bedside. Anesthesia notes, intraoperative medications, post-op orders. She read it the way she read everything under pressure. Fast and specific, looking for the thing that didn't fit. Most of it fit. And then she reached the post-op pain management protocol and stopped. Who ordered the post-op fentanyl dose? Reeves frowned. Standard protocol? The anesthesiologist. At 0.5 micrograms per kilo per hour. That's within range for a child hurt. Her weight on admission was estimated at 24 kilograms, Emily said. The protocol dose was calculated on 32. Someone input the wrong weight. She showed him the tablet. At 0.5 on 32 kilos, she's getting a third more opioid than she should be. which in a child with intracranial pressure concerns will suppress respiratory drive and delay arousal, and increase CO2, which dilates cerebral vasculature, which increases ICP. Reeves said it quietly, the way you said something when you were angry at yourself for not catching it first. He looked at the tablet, then at the monitor, then back at Emily. Reduce the infusion rate. Already calculating, she had the correct dose in her head by the time she said it. 0.5 on 24 kilograms. Reduce infusion to... Do it! He said it without hesitation, the clean transfer of authority that only happened between people who trusted each other's competence. And get me the anesthesiologist on call. I want to know how the weight was entered wrong. Emily adjusted the infusion rate, documented it, and flagged the discrepancy in the medication record with a timestamp. The kind of medication error that happened not through malice, but through the compressible chaos of a mass casualty event. Someone had grabbed the wrong weight estimate, probably in the first frantic minutes of admission, and it had propagated through the system. Nobody's fault in the way that actually assigned blame, but someone's error all the same, and catching it mattered. She watched the monitor. 8 minutes later, Lily's ICP began to come down. 12 minutes after that, the girl moved her left hand. It wasn't much, a small, reflexive curl of fingers against the blanket. But Reeves, who had been watching the monitor with the patience of a man who had long ago made peace with waiting, exhaled in a way that was almost inaudible. There she is, he said. Emily didn't say anything. She put her hand near Lily's, not on it, just near it, and watched the small fingers unfold and settle, and then, slowly, over the next several minutes, begin to respond to stimulation with increasing consistency. By the time Lily's eyes half opened, glassy and unfocused, the confused emergence of a child coming out of anesthesia who had no idea yet what had happened to her or where she was, Emily had already updated the nursing notes, flagged the recovery team on the monitoring protocol, and was calculating how long before Diane Kowalski could safely see her daughter. Carter. Reeves's voice beside her. She looked up. That was the second time today you caught something I should have caught first. He said it plainly, without the defensive architecture that most physicians built around admissions like that. I want to know why you're in facilities support. Politics, she said. Whose? Holt's. He was quiet for a moment. Reeves had been at Blackstone for 9 years. That meant he'd watched Holt operate for 9 years, which meant the name produced an expression on his face that wasn't exactly surprise. The press conference, he said. He'd heard then. Word moved fast in a hospital. Starts in 20 minutes. Reeves looked at Lily, who was blinking slowly now, her eyes finding the light above her and holding it with the slightly baffled focus of returning consciousness. Then he looked at Emily. I'll be there, he said. She had 17 minutes. She used 4 of them to find Voss, who was in the corridor outside the recovery room with 2 of his soldiers and a phone pressed to his ear. He ended the call when he saw her face. Lily, he said. Stable, waking up. She pulled him slightly aside. Reeves is going to the press conference. I need you to know what I'm planning. Tell me. I'm not going to stop Holt from talking. I'm going to let him make his statement. She watched Voss read that. He's going to get up in front of cameras and describe what happened today in a way that makes me look like a rogue operator who endangered patients. And while he's talking, I need Mercer to be ready. Ready to do what exactly? To release the JAG inquiry findings to the medical board and the press simultaneously. She kept her voice level. Not afterward. While he's talking, I want him to finish his statement and walk into it. Voss was quiet for 3 seconds. It wasn't hesitation. She knew what his hesitation looked like, and this wasn't it. It was calculation. Mercer can do that, he said. The inquiry findings were cleared for release an hour ago. She's been waiting on timing. Now is the timing. He was already dialing. Emily used the remaining 13 minutes to find Huang, who was finishing up documentation at the nurse's station, and Patricia, who was at the medication cart, and Webb, who was in the break room eating a sandwich with the mechanical focus of someone who hadn't eaten since morning and was only now remembering that his body existed. Press conference in the administrative conference room, she said to all 3 of them, at different points in the next 10 minutes. 3rd floor. If you want to be there, be there. I'm not asking you to do anything. I'm just telling you where I'll be. All three of them came. The administrative conference room at Blackstone had been set up with the modest but deliberate staging of institutional damage control, a podium, the hospital logo on a banner behind it, 4 chairs arranged to the side for what Emily guessed would be Holt, Farrell, the legal counsel Barrett, and someone else she hadn't identified yet. There were 6 members of press present, local news, 1 regional outlet, a hospital industry publication, with cameras and recorders, filling the chairs on the other side of the room. Emily stood at the back. Voss stood beside her. Behind them, Huang and Patricia and Webb arranged themselves with the slightly uncertain positioning of people who weren't sure of their role but had decided to be present for it anyway. Holt came in at exactly the announced time, which meant he'd been waiting outside the door timing his entrance, which told Emily something about how he was managing his anxiety. He had changed into a fresh white coat. His hair was combed. He had the prepared solemnity of a man who had rehearsed his expression and was now wearing it. Farrell came in behind him in his suit, then Barrett, then a 4th man Emily recognized after a moment as the hospital's communications director, who had presumably designed whatever this was. Holt reached the podium, adjusted the microphone, looked at the room with the gravity of someone who had decided he was the protagonist of this moment. He didn't look at the back of the room. Not yet. "Thank you for coming on short notice," he began. "As many of you are aware, Blackstone Regional Hospital experienced a series of significant events today involving military personnel and civilian casualties." He paused professionally. "We are grateful for the opportunity to care for these patients, and our thoughts remain with them and their families." The preamble, setting the tone of responsibility and concern before the pivot. "However," he straightened slightly, "we have an obligation to transparency regarding events that occurred in our emergency department this morning and this afternoon. An individual operating in a non-clinical support capacity, not a licensed treating provider in this facility, performed direct medical interventions on multiple patients, including critically ill children, without physician authorization and outside the scope of any sanctioned role." He was building it carefully, giving the press the frame before the name. "We want to be clear that Blackstone Regional takes patient safety." "Dr. Holt!" The voice came from the doorway to the left of the podium, not the back of the room. Emily hadn't moved. The voice belonged to a woman in her early 40s in a military uniform, compact and precise in the way of people who measured their words before they spent them. Captain Diane Mercer, JAG, walked into the room with a folder in one hand and a composure that made the room feel slightly smaller. Holt stopped. "My apologies for the interruption," Mercer said, without sounding apologetic at all. She addressed the press rather than Holt, which was a deliberate choice and visibly registered as such. "I'm Captain Diane Mercer, Judge Advocate General's Corps. I'd like to provide some context for what you're about to hear, if the room will allow it." One of the reporters, a woman from the regional outlet, with the alert expression of someone who could smell a better story arriving, said, "Please." Mercer opened the folder. "As of 1100 hours today, the JAG office has completed an expedited preliminary inquiry into allegations made against a Blackstone regional employee. Those allegations, submitted to a federal credentialing database 4 days ago and signed by Dr. Marcus Holt and Chief Administrative Officer Douglas Farrell, claimed that the military service record of Lieutenant Emily Carter was fraudulent." The room shifted. 2 reporters were already writing. "I can confirm," Mercer continued, "that Lieutenant Carter's service record is entirely authentic. She served 6 years, including 2 combat deployments, and held the rank of Advanced Trauma Specialist within the 3rd Special Operations Casualty Response Unit. Her record includes documented commendations for field performance that I am not at liberty to fully detail in an open setting." She looked up from the folder. "The allegation of fabrication is false. The submission of that allegation to a federal database constitutes interference with military records under federal statute." Holt's face had done something complicated. The prepared gravity had fragmented into something less composed, the expression of a man watching the stage he'd built collapse under him in real time. Farrell, to his right, had gone very still, the kind of still that was its own answer. "Additionally," Mercer said, "the JAG inquiry, conducted in coordination with the State Medical Board, has reviewed internal communications obtained from this hospital's records. Those communications indicate a coordinated effort between hospital administration and certain medical staff to fabricate performance complaints against Lieutenant Carter, facilitate her reassignment, and ultimately force her departure from the institution. She paused. This pattern has been identified in connection with at least 3 other nursing staff members over the past 18 months. The reporter from the regional outlet had stopped writing. She was looking at Holt. So was everyone else. Holt gripped the edges of the podium. He was trying to find the version of his face that looked in control and not quite getting there. These allegations are the hospital disputes. There's a process. Dr. Holt. Barrett, the hospital counsel, spoke from the side, low and urgent, the voice of a lawyer watching liability metastasize in real time. I'd advise, the state medical board has opened a formal investigation, Mercer said, over both of them, without raising her voice. Dr. Holt and Mr. Farrell have been formally notified as of... She checked her watch. 4 minutes ago. Barrett stood up. He said something to Holt that Emily couldn't hear from the back of the room, but that made Holt's hand come off the podium and drop to his side. The communications director, who had presumably designed this press conference to be a very different kind of event, was looking at his phone with the expression of a man watching his professional reputation leave the building without him. Emily, at the back of the room, watched all of it. She didn't feel triumphant. That wasn't quite the right word for what she felt. It was more like the specific settling sensation of a weight that had been slightly off balance for months, finally finding its correct position. Not dramatic, just right. Boss beside her said nothing. He didn't need to. Diane's voice was steady but compressed, the way voices got when the emotion behind them was real and large, and being very carefully managed. About 20 minutes ago, she looked at me and she said, "Mom," and then she went back to sleep. A pause. That was enough. That was more than enough. Emily stood there for a moment. The monitor above Lily's bed showed a waveform that was trending in the right direction. The ICP reading had been stable for 40 minutes. "Your husband," Emily said. "He's been asking about her since he came out of sedation. The nurses upstairs have been giving him updates, but I know. I'm going up to see him in a little while. Diane looked at her daughter. "I needed to be here first." "Of course." "Will she..." Diane stopped, started differently. "What's the realistic picture? Not the careful version. The real one." Emily looked at Lily. 8 years old, bright braids, small hands, a subdural hematoma, a surgical decompression, a medication error caught before it compounded. "She's going to need monitoring for the next 48 hours. The ICP trend is good right now. She's showing neurological responses that are improving, which is what we want to see." She paused. "There's no guarantee with head injuries. There are things we won't know for a few days. But the trajectory right now is better than it was when she came in. Significantly better." Diane nodded slowly. It wasn't relief exactly. It was the acknowledgement of someone who understood the difference between a good trajectory and a certainty, and was choosing to hold on to the former without pretending it was the latter. "My husband is going to want to thank you," Diane said. "He doesn't need to." "He will anyway." She looked up. "You were on his case this morning too. Before I even got here, you were the one who..." "I was doing my job," Emily said. She meant it literally, not modestly. Diane looked at her for a long moment. "They had you mopping floors," she said. "Yes." "That's..." She seemed to search for a word and then give up on finding one that was adequate. "That's something." Emily left her with her daughter. The next several hours moved in the specific way that the aftermath of a crisis always moved. Not cleanly, not in a straight line from chaos to resolution, but in the uneven rhythm of things being processed and sorted and accounted for while other things were still actively in motion. The state medical board's investigator, a precise woman named Carolyn Nast, who had the energy of someone who had been waiting a long time for enough evidence to act, arrived at Blackstone at 5:15 and spent 3 hours in the administrative wing with access to the hospital's records. Emily didn't see her directly, but Huang reported that she'd been in Holt's office and that 2 people from the HR department had been brought in to answer questions, and that both of them had the look of people who were deciding very quickly which side of a line they were on. The JAG finding had been reported by 2 of the local news outlets by 6 o'clock. By 7, the regional outlet had a full story with Mercer's statement, the outline of the investigation, and a brief factual description of what had happened in the ER that morning. Emily's name was in it. She didn't love that, but she'd known it was coming and she'd made her calculation. At 7:30, Reeves found her in the break room where she was finally eating something real, a sandwich from the cafeteria, slightly cold, perfectly adequate, and sat down across from her with a coffee he'd apparently been carrying around since the afternoon. "Lily's parents are together," he said. "They moved a cot into her recovery room. The nursing staff is pretending not to notice." "Good." Tommy's parents arrived around 6. He's stable, still in PICU, but his numbers are good. He turned the coffee cup in his hands. The 5 others are all expected to be discharged within the next day or 2. Emily ate her sandwich and let that land. All 8 children, none of them lost. Barrett has apparently advised both Holt and Farrell not to come back to the hospital pending the investigation, Reeves continued. NAS's team is doing a full administrative review. They've also pulled the files on the 3 nurses who left in the past 18 months. He paused. One of them was a woman named Karen Saul. She was an ER nurse. Lost her license 6 months ago based on fabricated documentation. Very similar pattern to yours. What happens to her? If the investigation confirms the fabrication, the board can reverse a license revocation. It's rare, but it happens. He looked at Emily. NAST apparently already has her contact information. Emily finished the sandwich, put the wrapper in the bin, sat for a moment with her hands flat on the table, and thought about Karen Saul, whoever she was, sitting somewhere outside the institution that had ground her down and taken her license, not knowing yet that someone was about to call. "You should go home, Mo," Reeves said. "I know. You've been here for—" He checked his watch. 14 hours. "I know. I'm not asking. I'm telling. As the attending physician currently running this floor, I'm telling you that you need to leave the building and sleep." He paused. "You can come back tomorrow. Everything will still be here tomorrow." She looked at him. "Everything including the investigation?" "Yes. Including that." He met her eyes. "Carter, you won today, multiple times. Go home." She thought about the word won. It felt imprecise. She hadn't come to work this morning to win anything. She'd come to push a mop bucket down a hallway and document the experience of being systematically erased, and instead 6 soldiers had shown up, and then 8 children and a press conference and a JAG inquiry. And somewhere in all of that, the architecture that Holt had built to contain her had not so much collapsed as been disassembled in public, in front of cameras, by someone in a military uniform reading from a folder. But Kowalski was upstairs and his daughter was in recovery, and Tommy had a pulse, and she'd caught the medication error, and Huang had documented what he'd seen, and Patricia had said, "I'm in a position now," and Reeves had said, "You still had it," and she hadn't signed anything. That was a version of winning, an imperfect, exhausting, 14-hour version. "Okay," she said, "I'll go home." She left Reeves in the break room. She stopped at the nurse's station to sign off her documentation. Still meticulous, still time-stamped, because the documentation was evidence and it mattered. Patricia handed her a printout without comment, a confirmation that the formal response Emily had filed 3 weeks ago had been logged and escalated by the HR department, citing, apparently, new information warranting priority review. Someone in HR had decided which side of the line they were on. She got her jacket from the locker room. Her regular clothes were underneath the scrubs. She hadn't changed since morning, which she noticed now with the specific bodily awareness that returned when you stopped being in crisis mode and started being just a person in a building. She was tired in a way that went through her layers. She was almost to the exit when Voss fell into step beside her. "Heading out?" he said. "Reeves kicked me out." "Smart man." He walked with her through the main corridor, past the lobby, where this morning had started. The soldiers, the mop handle, the laughter that hadn't known what it was laughing at. It looked different now. Same fluorescent lights, same tile, same desk where Patricia had been standing when Voss had said, "Where is Lieutenant Emily Carter?" and the room had laughed. "Mercer wants a formal debrief tomorrow," he said. 10 o'clock, at the JAG office downtown. Routine part of the inquiry. You don't need to bring anything, just your account of the events. I'll be there. They reached the sliding doors. Outside, the parking lot was quiet in the way that hospital parking lots were quiet at night. A few cars, the glow of the entrance lights, the ambient sound of a city that didn't know what had happened in this building today. Emily. Voss stopped at the threshold. For what it's worth? What you did today? Not the politics, not the investigation. The medicine, Kowalski, his daughter, Tommy. He paused. That's why you were the one we came for. Not because of rank or record, because of what you do when it matters. She looked at him. Damon Voss was not a man who said things he didn't mean. She'd known that since before she could remember knowing it, the way you absorbed certain truths about people through extended proximity in difficult conditions. I know, she said. It wasn't arrogance. It was just true. The same way knowing the correct medication dose was just true. She knew what she could do. She'd always known. The problem had been finding herself in a building full of people who'd decided she couldn't. She walked out. The night air was cool, the kind of mid-autumn cool that clarified things, cut through the accumulated heat of a long interior day. She stood for a moment outside the sliding doors, not going anywhere yet, just breathing. Her phone buzzed. She looked at it. Unknown number, different area code than Mercer's. She almost let it go to voicemail. Then she answered it. Silence for a moment. Then a woman's voice, tentative, not quite calibrated to the weight of the call it was making. Is this Emily Carter? Yes. I'm sorry to call so late. My name is Karen Saul. Someone from the state medical board called me an hour ago. They said, a pause. The voice steadied itself. They said my case is being reopened. They said there's evidence that the documentation against me was falsified. Another pause. They gave me your name. They said you were the reason they found it. Emily stood in the parking lot of Blackstone Regional Hospital with the lights of the entrance behind her and the city spread out in the middle distance and the phone against her ear. I didn't do anything specific for you, she said. It came out of the investigation into what happened to me. I know, they explained that. Karen Saul's voice had a quality Emily recognized, the sound of someone who had been carrying something heavy for long enough that the announcement of its possible removal hadn't yet produced relief, just a kind of stunned recalibration. I lost my license 8 months ago. I've been working at a grocery store. She stopped. I'm sorry. I don't know why I'm calling. They gave me your name and It's okay, Emily said. I'm glad you called. A silence. Do you think they'll actually restore it? Karen said. My license. Do you think they actually... I think the evidence is clear, Emily said. I think NAST is thorough. I think you should talk to an attorney tomorrow, someone who specializes in medical licensing, and I think you should document everything you remember about your time at Blackstone while it's accessible. A pause. And I think... She stopped. What she thought was that Karen Saul had spent 8 months scanning groceries because Marcus Holt had needed her gone, which was a specific kind of wrong that couldn't be measured on any scale available to her right now. I think it matters. What happened to you? It mattered before today, too. Karen Saul was quiet for a long time. Thank you, she said finally. Emily said goodnight and ended the call. She stood for another moment in the parking lot. Then she took 3 steps toward her car before her phone buzzed again. This time a text from a number she recognized as Mercer's. Heads up. Board has formally suspended Holt's admitting privileges pending investigation. Farrell placed on administrative leave. Hospital board meeting called for 800 tomorrow. They'll be looking for emergency interim leadership. She read it twice. Then she kept walking. Her car was in the far lot. She'd parked there this morning the way she always parked there, out of the habit of not taking the close spaces that were harder to maneuver out of in a hurry, an old tactical instinct that had never left her. She reached it, unlocked it, sat down in the driver's seat. She didn't start the engine immediately. She sat in the quiet of the car and let the day settle through her in layers. The convoy, the soldiers, Kowalski's face, Lily's small hand curling against the blanket, the needle going in, the rhythm coming back, Reeves saying, "Do it," Mercer walking through the door, Holt's hands on the podium, Karen Saul's voice. She was reaching for the ignition when she noticed on the passenger seat the JAG document that Voss had handed her this morning in the supply room. She'd moved it from her scrub pocket to her bag and then to the seat at some point in the afternoon. She'd forgotten it was there. She picked it up. Under the official inquiry letterhead, under her name and service record, and the formal language of the allegation and its dismissal, there was a handwritten note in the margin that she hadn't noticed before. Not Voss's handwriting, smaller, more precise. Full record review complete. Commendation documentation flagged for formal recognition. See attached addendum. Classification level reduced, eligible for public service record. She turned the page. The addendum was 3 pages. She'd never seen it before. She would have known if it had been part of the original file. It described an operation, dates she recognized, a location she couldn't name even now in her own head without the old reflexive caution. And a casualty count. Not the kind of casualties that were losses, but the kind that were saves. 41. 41 individuals in a situation where the medical outcome should statistically have been worse by a significant margin, and the reason it wasn't was documented on these pages in dry, precise military language that she was reading for the first time. 41. She hadn't known they'd counted. She hadn't known anyone had written it down. At the bottom of the addendum, another handwritten note, different pen, different hand. These records were suppressed in the original transfer to civilian status. The error has been identified. Correction process initiated. She sat with that for a long time in the dark car in the parking lot. Then her phone lit up again. This time, it was a number she didn't know, but the message that came through was from a name she recognized. It was the hospital board chair, a woman named Dr. Iris Maddox, who had been on the Blackstone board for 7 years and who Emily had never met. The message was 4 sentences. Ms. Carter, I've been briefed on today's events. The board meets tomorrow at 0800. We'd like you present. Emily looked at the message. She thought about the board meeting and Mercer's text about interim leadership and Reeves telling her to go home and Karen Saul's voice and Kowalski's daughter breathing in a recovery room and 41 names written down at the bottom of a page she hadn't known existed until tonight. She started the car. And as she pulled out of the parking lot, headlights sweeping across the front of Blackstone Regional Hospital, she saw, through the glass of the lobby, lit from within, 2 figures she recognized as Holt and Barrett, still inside, and a third figure she took a moment to identify as one of NAS's investigators, and the body language of all 3 of them told her, even from this distance, even through glass, that the conversation happening in that lobby was not going the way that Holt had planned anything today. She drove past without stopping. Whatever that conversation was, she didn't need to be in it. She had somewhere to be at 8 in the morning, and between now and then she needed sleep, and the thing she'd spent 6 weeks being told she wasn't, capable, credentialed, worth the space she occupied, had tonight been written down in a federal document and entered into a permanent record that no one could quietly reassign to facilities support. She turned onto the main road and drove toward home through the lit city and did not look back. Behind her, through the lobby glass, she could not have seen what happened 40 minutes after she left. The moment when NAS's investigator produced a second document, one that Holt and Farrell had not been told existed. A communication log from the staffing firm's internal server, obtained through a parallel investigation that had been running for 3 weeks before today and had only needed Blackstone Regional to complete its evidence set, and set it on the table in front of them, and watched 2 men read their own words back to themselves for the first time with the full weight of what those words would cost them finally, unmistakably clear. She slept 6 hours. It wasn't enough, and it was what she had. The alarm went off at 6:15 and she lay still for approximately 45 seconds, which was the maximum she allowed herself, and then she got up, made coffee, stood at the kitchen window with the mug warming her hands, and watched the city come into its morning shape. The delivery trucks, the early commuters, the particular gray-pink quality of autumn light at 6:30 that she'd always found clarifying rather than bleak. She thought about the addendum, the 41 names she hadn't known anyone had counted. She'd read it twice more after getting home, sitting at the same kitchen table where she'd filled out the HR complaint form 3 weeks ago. and each time it had produced the same sensation. Not pride exactly, more like recognition. The way you felt when someone described an experience you'd had and used exactly the right words for it. Someone had found the right words. Someone had written them down. It had taken 2 years and a federal inquiry and a staffing firm's internal server, but the words existed now in a document with an official seal, and they weren't going anywhere. She got dressed. She chose her clothes deliberately. Not scrubs, not the facility's uniform, but the dark jacket and the fitted shirt she'd bought 6 months ago and worn approximately once. The outfit that existed for situations where how you looked was information you were communicating on purpose. She drove back to Blackstone Regional Hospital. The board meeting was in the main conference room on the 4th floor, the one used for senior leadership and not for press conferences. And when Emily walked in at 7:58, it was already occupied by 7 people she mostly didn't know, and 1 she did. Dr. Iris Maddox was 61, had silver hair cut practically short, and looked at Emily when she entered with the direct, assessing gaze of a woman who had long ago stopped being interested in managing impressions. She stood and extended a hand. "Miss Carter, thank you for coming." "Dr. Maddox." The other 6 board members introduced themselves in the efficient way of people who had somewhere to be. Emily registered the names and faces and filed them. She sat where Maddox indicated, at the side of the table rather than the end, which was a deliberate positioning, and she understood it. She was here as an informant and a subject, not yet as anything else. Maddox opened without preamble. "You've been briefed on where things stand with Dr. Holt and Mr. Farrell." "Partially." "Let me complete the picture." She folded her hands on the table. Both men met with Investigator Nast last night for approximately 2 hours. Their counsel was present. At the end of that meeting, both of them tendered their resignations from Blackstone Regional, effective immediately. She paused. The resignations do not affect the State Medical Board investigation or the JAG inquiry. Those proceed regardless. But the hospital's position is that we are not waiting for external processes to conclude before taking internal action. Emily nodded once. The board has been reviewing the internal communications obtained by the investigation. We've also reviewed the personnel files of staff members who left this institution in the past 24 months under circumstances that now appear to require scrutiny. Maddox's voice was even, but something ran beneath it. Not quite anger, something colder and more purposeful than anger. What was done here was systematic. It was designed to be deniable. And it worked for a period of time because the people running it understood how institutional inertia protects bad actors. She looked at Emily. That ends with this board's watch. A board member to Emily's left, a man named Stein, 50s, the kind of physician who'd moved into hospital governance, said, "We'd like your account of the past 8 months, particularly the period leading up to your reassignment and your formal response filing. In your own words, without filtering." Emily told them. She'd told versions of it before, Dick, to Voss, to Mercer, to the HR form that Gerald had handed her with his lunch on his desk. But this version was different because this room was different. This room had power, the institutional kind, the kind that moved slowly and then moved everything when it finally moved. She didn't perform it. She didn't soften the edges. She described what had happened in the order it had happened, including the parts that didn't make her look good. The moments she'd hesitated, the things she hadn't pushed back on when maybe she should have. The weeks she'd spent in facilities support telling herself it was temporary when she'd known, probably, that it wasn't. When she finished, the room was quiet for a moment. Maddox said, "The board wants to discuss certain staffing matters with you. But before we do, I want to ask you a direct question, and I want a direct answer." "All right. Do you want to be here? Not as a matter of pride or vindication. Not because leaving would feel like losing. Do you actually want to be a nurse in this hospital?" Emily looked at her. It was a good question. It was possibly the first genuinely good question anyone in this building had asked her. "I want to do the work," she said. "The medicine. Whether I do it here or somewhere else is secondary." She paused. "But the work that happened yesterday, the coordination between military medical units and civilian trauma response, that work needs to exist somewhere in a structure. Blackstone has the infrastructure to do it. If I can be part of building that, then yes. I want to be here." Maddox held her gaze for a moment. Then she looked at the board. "We're in agreement. she said to the room. Then to Emily, "We'd like to offer you a position as Director of Emergency Trauma Training. It's a new role. This board is creating it this morning. The mandate is developing cooperative protocols between civilian ER operations and military medical units. Salary adjusted to reflect the seniority and specialization. Full reinstatement of your nursing credentials with a formal notation of wrongful reassignment in your file." She paused. "And a written apology from this institution. Not a press release. A letter. Signed by this board." The room waited. Emily thought about the mop bucket, the way Denise Marlowe had handed her the assignment sheet without making eye contact, the granola bar she'd eaten at noon yesterday because there hadn't been time for anything else, Kowalski asking her to stay with him while she worked, Lily's hand curling against the blanket, Tommy's rhythm coming back. "Yes," she said. The formal announcement went out at 11 that morning. Emily didn't write it and didn't see it before it went out, which was fine. She'd been in the hospital since 8, and she was in the ER when it dropped, reviewing the trauma bay configuration with Huang and 2 other nurses, talking through the gaps she'd identified in the pediatric equipment that had nearly cost them time the day before. She found out the announcement had gone out when Huang read it on his phone and looked at her with an expression she couldn't quite name, somewhere between vindicated and slightly overwhelmed, and said, "Director, that's the right call." "It's a new role," she said. "It doesn't exist yet. We have to build it." "We?" She looked at him. "You documented what you saw yesterday. You stayed when you didn't have to. That's the kind of person I need on a trauma response team." A pause. "If you want it." Huang looked at the supply cart he'd been reorganizing, then at her. Yeah, I want it." Patricia found her at noon. She came around the nurses' station with a directness that was new, or rather that had been there before but had operated behind caution, and now the caution was gone. "I heard about the appointment," Patricia said. "Word moves fast." "It always did." She met Emily's eyes. "What I said yesterday, about being in a position now. I meant it then, and I mean it more now." "I know," Emily said. "I'm going to need people who know this hospital, who know the staff, the rhythms, the gaps. You know all of that." Patricia straightened slightly, just slightly. "I can do that." "Good." They were standing there in the particular alliance of 2 women who had navigated the same institution from very different positions and had arrived by different routes at the same place when Emily's phone buzzed. It was Reeves. A text. "Lily asked for pancakes this morning. Staff said she was very specific about the syrup ratio. I'm choosing to take this as a positive neurological sign." Emily read it twice. Something in her chest shifted. Not dramatically, just a small internal correction, the way a compass needle settles when you move it away from interference. She typed back, "Tell her we'll work on it." The formal outcomes arrived over the following 3 weeks in the way that institutional justice always arrived. Not in a dramatic single moment, but in a series of documented, official, permanent steps that accumulated into something that couldn't be undone. Marcus Holt's medical license was suspended by the state medical board pending a full disciplinary hearing, the outcome of which, Nass told Emily in a brief call, was not in significant doubt given the volume of documentary evidence. The staffing firm that had been central to the scheme was under investigation by the state attorney general's office. Douglas Farrell faced civil liability for the fabricated credentialing allegations, which had caused documented professional harm to at least 4 individuals, Karen Saul among them. Karen Saul's license was formally reinstated on a Tuesday morning, 23 days after the day Emily had stood in the Blackstone parking lot and heard her voice on the phone for the first time. Emily got a text. Karen had gotten her number from Mercer that said only, "It's back. Thank you." Emily sat with that for a moment and then wrote back, "You did that. You held on long enough for it to happen." The 2 physicians who had filed false complaints as part of Holt's arrangement received formal censures and were placed under supervised practice pending review. The HR director who had processed the fabricated documentation without questioning it was let go, though that outcome, Emily thought, was incomplete. The institutional pressure that had made looking away seem like the safer option was the real problem, And you didn't fix that by removing one person. You fixed it by building systems that made looking away impossible. That was going to be a longer project. She was already thinking about it. The commendation came on a Thursday. Voss called ahead to tell her it was coming, which was characteristic of him. He'd never been a man who believed in surprises when preparation was possible. The formal military commendation for her service record, including the newly declassified addendum, was presented in a brief ceremony at the JAG regional office on a gray November morning, with Mercer officiating and Voss present, and two other officers she vaguely recognized from the casualty response unit standing in the back of the room. There were no speeches, because military ceremonies at that level didn't run on speeches. There was the reading of the commendation language, which was formal and precise, and which included the number 41 without elaboration. There was the presentation of the document. There was a handshake from Mercer and a nod from Voss that carried the specific weight of acknowledgement between people who had operated in the same context and understood what the context had cost. Afterward, in the parking lot, Voss stood beside her for a moment in the gray November air. "Welcome back, Lieutenant," he said. She looked at him. The title landed differently now than it had when he'd said it the day of the convoy, not like a revelation, but like something that had always been there and had simply been obstructed from view for a while. "I never stopped serving," she said. It was true in both directions. She'd known it all along. The work didn't stop because the uniform came off. The knowledge didn't leave because the institution tried to tell you it wasn't real. What you knew, you knew. What you could still do, in a supply room without enough light or a trauma bay in the middle of a Saturday that was supposed to be someone else's problem. The ceremony had been small. That was fine. The important things usually were. She was in the ER on the last day of November when Kowalski came to find her. He was still moving carefully. The surgical repair had gone well, but the body took its own time, and he had the gait of a man who had been recently reminded that he was not, in fact, indestructible. He had Lily beside him. She was small and alive and wearing a purple jacket over her hospital bracelet, which she hadn't had removed yet because, according to Diane, she'd decided she liked it. Lily looked at Emily with the frank, direct attention of an 8-year-old who had not yet learned to dress her curiosity in social formality. "You're the one who fixed me," she said. "I helped," Emily said. "Dr. Reeves did most of the fixing. He said you told him what to do." Emily considered how to answer that accurately without misrepresenting either herself or Reeves, which was a more complicated diplomatic task than it sounded. "We worked together," she said. Lily seemed to find this acceptable. She looked around the trauma bay with the interested, assessing gaze of someone making a mental inventory. "Is this where it happened?" "Some of it. It looks smaller than I thought it would." "Most places do," Emily said. Kowalski, who had been standing just behind his daughter with his hands in his jacket pockets and an expression that had too many things in it to name simply, said, "I wanted to come before we went home. I should have come sooner. You were recovering. Still." He was quiet for a moment. "I know what you did. In here. In the morning." He paused. "And then for Lily. I know how that morning went for you before we arrived. And I know you still, He stopped. "Try it again. I know what it cost you just to be in this building at all, given what they'd done. And you still—" "Kowalski," she said. He looked at her. "You kept talking when I needed you to. You stayed with me." She paused. "Columbus." It took him a second. Then something in his face shifted. The recognition of a man realizing that she remembered, that in the middle of the worst minutes of his morning she had been paying enough attention to hold on to a detail about where he was from. He nodded. Once. The specific nod of a soldier acknowledging something that words would only reduce. Lily had moved slightly away and was looking at the equipment with the same systematic attention as before. "Can I be a doctor?" she asked, to the room in general. "You can be whatever you're willing to work for," Emily said. Lily considered this with the seriousness it deserved. "What if I want to be the kind that fixes brains?" "Then you work very hard for a very long time, and you learn everything twice, and you don't let anyone tell you that you can't." Lily looked at her with the particular clarity that children had before they learned to complicate simple truths. Did someone tell you that you couldn't? Yes, Emily said. What did you do? Emily thought about the mop bucket, the assignment sheet, the form she'd filled out at her kitchen table, the 6 weeks of silence in which she had absorbed everything that had been done to her and had not broken and had not gone, and had kept showing up because the work was the work, and she had never once stopped knowing what she was. I kept doing it anyway, she said. Lily nodded, the way 8-year-olds nodded when they heard something that matched what they already knew. They left a few minutes later, Kowalski with his careful gait, Lily still wearing the hospital bracelet, Diane with her arm through her husband's. Emily watched them walk down the corridor until they turned the corner, and then she turned back to the ER. Huang was at the station updating the new trauma response protocol binder that they'd started building 2 weeks ago. Patricia was at the medication cart. Webb was on consult for a post-op case upstairs, but he'd been down twice already that morning. The bay had the quality of a room that was functioning the way it was supposed to function, not perfectly, because nothing did, but, well, purposefully. There was a shift briefing in 10 minutes. There was a meeting with the military liaison office in the afternoon about the cross-training schedule for the new program's first cohort. There was a call with Karen Saul scheduled for tomorrow, the first formal conversation they'd have about how Emily's new role might support other nurses who'd been pushed out by similar schemes. There were more of them they'd found, in other hospitals, in other cities, and that problem didn't fix itself. The work did not end. It never had. That was the point of it. Emily Carter, Director of Emergency Trauma Training at Blackstone Regional Hospital, formerly Lieutenant Emily Carter of the 3rd Special Operations Casualty Response Unit, woman who had been handed a mop and told to stay out of the way, picked up the briefing clipboard and walked into the trauma bay. What they had tried to take from her, her record, her credibility, her right to occupy the space she'd earned, had not been takeable. Not because institutions couldn't cause damage, because they could and they had, but because the thing they'd been trying to erase had never lived in a file or a title or a set of credentials. It had lived in the hands that knew what to do in the dark when the generator failed. It had lived in the part of her that had kept showing up, kept documenting, kept filling out forms in quiet kitchens, kept working the next section of hallway with a mop bucket because the shift wasn't over and she wasn't finished. You could reassign that. You couldn't remove it. The real lesson, the one that the Karen Sauls of the world deserved to hear and the Holts of the world spent their careers trying to suppress, was not that strength eventually gets recognized. Sometimes it doesn't. Sometimes the institution wins, and the file stays fabricated and the license doesn't come back and nobody calls. The lesson was simpler and harder than that. You do not need their recognition to know what you are. You do not need their permission to keep being it. The recognition, when it comes, is not the thing that made you real. You were always real. You were real in the supply room with the mop handle. You were real at the kitchen table at midnight filling out a form that went nowhere. You were real in every moment they told you that you weren't. The briefing started on time. Emily stood at the front of the bay and looked at the faces of the people she was building something with. Imperfect people, tired people, people who had their own versions of what it cost to keep showing up in a building that didn't always deserve them. And she thought, this is the work. Not the commendation, not the directorship, not the moment in the lobby when the soldiers stood at attention and the room finally understood. This, the next shift, the next patient, the next form filed carefully and time-stamped because documentation was evidence, and evidence mattered even when no one was watching, especially then. All right, she said, let's go.